across the state in the criminal code. So I can't remember, Julie will have to help me. 2015, 2016, I did the dual adjudication. But back and forth, I had some, at least a juvenile bill every year. I carry a lot of school safety bills as well. I just happened to have the only school safety bill that had occurred during the Parkland shooting down in Florida. And with that bill, a lot of attention was drawn to school safety. Not too long after that, there was a shooting in Noblesville, and some of the legislation that was being proposed was not good for juveniles, was not good for the state of Indiana, and literally I was fighting and preventing some bad legislation from taking place. I made a promise to the parents and grandparents of those who were injured in Noblesville that I would do something, and not just have it be random legislation show up and not well thought out. And this is 2 years in the making, getting us to this point. I hope this is an honest look at our system. Everybody who's on the call today, who's on this task force, you guys are our eyes and your ears. It's my hope that you will help improve the outcomes for youth across our state. And by being a part of this task force, you will help us identify folks that CSG can talk to and interview, and also be a voice yourself on behalf of youth in the state of Indiana. It's my hope that through all of this, we get a good picture of what our juvenile code looks like. We'd be able to alleviate any random acts of juvenile justice from occurring, and what I would call justice by geography. Depending on where you live in the state, you're going to have different reactions for juveniles based on specifically what might be available in that community and what might not be available in that community. So it's going to take a while, but if you can't tell, I'm a little bit excited about it. And can't wait for this to get started so that we can really make a difference on behalf of youth in the state of Indiana. I'm going to start by turning it over to Senator Kreider. He's my co-chair. I kind of voluntold him he was going to do it. I wouldn't want any other partner in doing this very important work. So what I'll do is have Senator Kreider introduce himself, give him a little background, and then if you wouldn't mind, I'll try to flip through this and have you guys introduce yourself and tell us what your background is a little bit as well.
Thanks, Wendy. It's good to be with the group, and it's good to be a member of the task force. I also have focused on what I consider vulnerable populations as I've done my legislative work. I've been to several of the meetings that were sponsored by the Annie Casey Foundation that were hosted on the national level, and have been part of this discussion for the last several years. But I think that the timing of having a focused discussion around this issue is timely. I'm looking forward to seeing what the outcomes are, hopefully being supportive of legislation that comes out of this discussion. I've really been focused heavily on mental health issues, and I really have met with some of the same parents that Representative McNamara spoke about, who are really concerned about trying to get appropriate outcomes for the situations that we've seen that have cropped up around the state. And so I'm looking forward to the discussion. I appreciate the participation that we've seen, the folks that are voluntarily taking their time to be a part of this important discussion, and happy to contribute in whatever way I can.
I'm new with technology today. Okay. I see Representative Shackelford. I will go to her next. just introduce yourself. And
Hi, thanks Wendy. Thanks Mike for putting this task force together. As you stated, it is greatly needed. I'm State Representative Robin Shackelford here in Indianapolis on the East and Far East Side, House District 98.
all right, and I'm just going to kind of go across how you are on my screen. And if I miss anybody, I apologize. But we'll start with Susan Lightfoot.
Good morning. I'm Susan Lightfoot. I'm Chief Probation Officer in Henry County, and it's my pleasure to be a part of this task force. I've been working with youth and families right here in this community for 36 years, and I'm very proud to be a part of this. Thank you so much.
Thank you. William Whelan.
Hi, welcome everybody. I am the Chief of Police in Sellersburg, Indiana, and also the current IACP president in Indiana.
Julie.
Good morning, everyone. I'm Julie Whitman. I'm the Executive Director of the Commission on Improving the Status of Children, which is, if you don't know, a three-branch government commission focused on improving our state's response to vulnerable youth. This task force it sits under the Children's Commission, and I'm not a member of the task force. I'm really here to staff and help. And thank you all for your participation.
Cirilla.
Good morning, Cirilla Blackman. I'm Deputy Director with the Division of Mental Health and Addiction. I'm over addiction prevention, mental health promotion, child and family services, and health disparities, and also a member of the CISC as well, and very interested. This is very juveniles that are justice involved is very near and dear to my heart.
Thank you. Katie.
Good morning. My name is Katie Elmer. I'm the Deputy Chief of Staff for the Evansville-Vanderburgh School Corporation. For those of you unfamiliar, we are down in the southern tip of the state and the third largest corporation in Indiana. I've had the pleasure of working next to Wendy as a teacher this is my 20th year. So we've known each other for a long time and had a lot of great conversations around school and how to improve juvenile justice for kids. I sit on the board for the Youth Care Center, which is our local juvenile detention facility in Evansville. And I'm very passionate about juvenile justice and reintegration for kids back into the school after they have been in a facility.
Josh.
Good morning, everybody. I'm Josh Weber. I oversee the Juvenile Justice Program at the Council State Government's Justice Center. And want to thank Rep. McNamara for her leadership. As she said, it's been a long time. We've been having conversations about trying to partner with Indiana to help you take a look at and hopefully improve your juvenile justice system. So we really appreciate her leadership and all of your time, and are really looking forward to working with you all.
Carrie.
Hello, I'm Perry Black. I'm with Youth First, an organization focused on improving the mental health and well-being of young people. And we do that by partnering with schools, currently 91 schools from the southwest corner of Indiana, Mount Vernon and Posey County, near and dear to Wendy's heart, all the way up to Mooresville in Morgan County. So the southwest quadrant currently of Indiana is where our services and programs occur.
Thanks, Perry. Christina Ball.
Good morning. I'm the Deputy Chief Probation Officer with the Marion Superior Court. I've been a probation officer for almost 30 years right here in Marion County, both adult and juvenile. We were the first jurisdiction in the state to adopt JDAI, and most recently we've become involved with the Georgetown University Transforming Juvenile Probation Certificate Program. So I feel like I've been doing reform work for a lot of my career. So I'm looking forward to this. Thank you.
Judge Kenworth.
Good morning. I'm the judge in Grant Superior Court 2, and I'm here serving as president of the Indiana Council of Juvenile and Family Court Judges and chair of the Juvenile Justice Improvement Committee. So glad to be here and tying the judges into the conversation.
Justice David?
Good morning, everyone. Thank you, Representative McNamara, and thank you, Senator Kreider, for your leadership. Representative Shackelford, I'm looking at the Hollywood Squares, and it looks like a who's who in the know of everything juvenile in the state of Indiana. I work for you on the Indiana Supreme Court. Proud to be a little part of this, and anxious and excited to see what can be done to augment, enhance all the great things that all of you are involved in already, whether it's ICJI, already the legislative initiatives, JDAI, on and on. So I'm just thrilled to be a part of it. Thank you.
Thank you. Rudy? I don't want to disrupt your last name. Montesora? Rosa?
Monterosa, like Ponderosa.
Okay, great.
Good morning. My name is Rudy Monterosa. I'm a private practitioner here in South Bend, Indiana. We practice mainly in the area of criminal, family, and juvenile law, as well as immigration. I'm really excited to be a part of this task force. Locally, I serve as a school board member with the South Bend Community School Corporation. Today, I'm happy to share with you that we were featured, not only South Bend, but Indiana, on Good Morning America for the work that we've been doing as far as providing access to our students through our Wi-Fi buses. On a national level, I just finished a term with the American Bar Association's Commission on Youth at Risk. So this work that we're doing with youth is really dear to my heart. And I currently serve as the commissioner with the Special Committee on Hispanic Rights and Responsibilities with the American Bar Association. So I'm looking forward to a robust conversation, excited to be a part of this task force.
Thank you. I like Nancy's little hand clap there. She's more technologically advanced than I am. Look at that. Don Travis. I like it. Don, you might still be on mute.
How's that?
Perfect. There we go.
Okay. I'm Don Travis. I'm Deputy Director with Department of Child Services over Juvenile Justice Initiatives and Support. My role here at the agency is to work with the probation departments, juvenile courts across the state to help get services the Department of Child Services pays for delinquent youth. I've been in this position for the last 7 years. Prior to that, I was the Chief Probation Officer in Howard County and spent about 27 years in probation, mainly in juvenile.
Thank you, Don. Nancy?
Good morning, everyone. I'm Nancy Weaver, and I'm the director of Indiana's Juvenile Detention Alternatives Initiative, which is the platform for youth justice system improvement in Indiana. We are active in 38 counties, some of which are just starting to explore JDAI, Posey County, coming on as a introductory site. And we, within those 38 counties, we have, they are home to approximately 72% of Indiana's youth population aged 10 to 17.
Thank you. Nina?
Good morning, everyone. I'm Nina Solomon with the Council of State Governments Justice Center. I just want to echo Josh's comments earlier, thanking Representative McNamara, Senator Kreider. It has been multiple years in the making. I think we started these conversations, 3 or some years ago. So really excited to be here and to the conversation this morning.
Thank you. Chase, is it Lie Day?
It's Lie Day, absolutely. I'm honored to be here today. I am the president of the Indiana School Resource Officers Association. I'm a board member for the National Association of School Resource Officers, where I serve on the training committee there to establish training standards and curriculum for school resource officers, and also serve as the chief of police for the Avon School Police Department. And so I am honored to be here. My role is to provide and to give the opportunity for the best training possible for the state school resource officers, and hopefully work through this group and some other entities to really establish what that training needs to look like throughout the state and require that training happens for police officers working in schools. So I am certainly honored to be here and thankful for your leadership, Representative McNamara and Senator Kreider.
Thank you. James Taylor?
Hi, good morning. Thank you all legislators for the invitation for schools to be at the table to take part in the discussion. I represent the Metropolitan School District of Warren Township, and I've been around for 30 years fighting for justice for our kids and for our families. We created a program several years back and to reduce suspensions and expulsions. And I can truly say to you all today that we've reduced our expulsions by 95%. So our goal is to decrease the racial disparities and to help kids stay in school and to stay on track. With that, we created a community resource center. We galvanized all of the resources in the community. We brought them together, and we will have our grand opening on October 30th. Write that down, everybody. We love to see you there, and to showcase what we're doing to keep our kids on track toward graduation, because that's what this is all about, getting our kids to the finish line so that they can become good citizens in our community. Also, we were the only school district awarded the Youth Assistance Program grant through DOE. The urban part of that, there are several other youth assistance programs started by Hamilton County and other counties, but Marion County, we're the first ones to receive that, and we will be launching that on October 30th also. I'd love to give you all more information.
Send an invite to Julie and she can disperse it to the rest of us.
Okay, I will do that. Thank you.
Thank you. Joe?
Hi, everybody. I'm Joel Wenicky. I'm a staff attorney at the Indiana Public Defender Council. So I'm here on behalf of Bernice Corley, our executive director, and I usually focus on juvenile issues and have experience as a frontline juvenile defender out in Putnam County for a few years, and also have some significant experience dealing with appeals, and I clerked with the Court of Appeals once upon a time. So I'm excited to join the group, and thank you for letting me tag along.
Thank you. Angela Sutton.
Good morning, everyone. I'm Angela Sutton. I am currently the Deputy Commissioner for Diversity and Development with the Indiana Department of Correction. That is a very new appointment. I'm on this task force because I was and am still operating in the role of Executive Director for the Division of Youth Services, where we oversee corrections, juvenile corrections for the state. The position, I was informed, was just posted probably 5 minutes ago. So if you know anyone who is passionate about juvenile justice and juvenile corrections and people in general, please send them our way. But hopefully, I plan to, and I've made my intentions very clear. My background is completely juvenile. I mean, and I plan to be in everyone's business regarding juvenile corrections. So the new executive director is going to have to deal with me. So I will be seeing you guys. Hopefully I will be able to remain on this juvenile justice task force moving forward as well.
Thank you very much. Emily Rogers.
Good morning, everybody. My name is Emily Rogers, and I'm a researcher with the CSG Justice Center.
Thank you. Chris.
Good morning. I'm Chris Naylor, the Executive Director for the Indiana Prosecuting Attorneys Council. We are a judicial branch state agency, primarily a training organization for Indiana's 700 or so prosecutors and deputy prosecutors. We also represent prosecutors on this collaborative committee work. I appreciate Representative McNamara and Senator Kreider's leadership on this. As Representative McNamara pointed out, the last 10 years, there hasn't been a comprehensive review of the juvenile code, and similar to 1006 for the adult justice system. I think this has been long overdue, and this looks like a really good mechanism to take a collaborative approach to see how we can improve our system. So it's great to be a part of this.
I think LSA told me it hasn't been looked at since 1993 or something like that. Yeah. It might have been even prior to that.
Right.
I'm probably getting it confused with the other one, which was, I think, 1983. Was that right? So, Angela Reed Brown.
Hello, my name is Angela Reed Brown, and I am the Court Improvement Program Administrator for the Indiana Office of Court Services. I also serve as a member on the Juvenile Justice and Cross-System Youth Task Force. And finally, I have been helping our judicial branch implement the dual status legislation that Representative McNamara spoke about earlier.
Thank you very much. Lisa Truitt.
Hi, good morning. I'm Lisa Truitt. I'm currently serving as the State Attendance Officer, as well as the Social, Emotional, and Behavioral Wellness Specialist for the Indiana Department of Education. One of my tasks as State Attendance Officer is to offer guidance, programming, and training around expulsion. And my background prior to coming to the department a year ago, I was assistant principal at Eastern Hancock Junior High in Hancock County, where I was a leader on our school safety commission, where we pulled together programming and how we were going to handle youth with judges, prosecutor, juvenile probation, and streamlined everything with all 4 county schools to make things, I guess, more fair, equitable, and just, I guess, the same in all 4 county schools so that everybody had the same expectations across the board. And this is my 22nd year as an educator.
Oh, great. Thank you very much. And Victoria, you can go ahead and introduce yourself. She's my partner in crime.
I'm Victoria Showski. I work for the House Republican Caucus as a policy analyst.
And she's been with me on this journey. So
yes, I was previously the representative's legislative assistant.
And then she left me. And then James Garrett. He's just waving hi. And then I see not their faces, but I believe they're here by phone. We've got Sarah Potter.
Hi, I'm Senator Kreider's legislative assistant. I'm just here to help co-host the meeting and take notes.
Okay. And Judge, I'm gonna destroy your last name. Judge Jason Chickowitz, is that how I say it? Oh, he says he typed his microphone just broke, but he's happy to be part of the task force. And somebody on here who knows how to pronounce his name so I don't massacre it, I would appreciate it.
I believe it's Chickowitz.
Chickowitz, okay, I was right.
And before he was a judge, we shared office space for many years.
Awesome, that's great. And then Senator Melton.
Thank you. Good morning to everyone. State Senator Eddie Melton, representing Senate District 3, which is Gary, Maryville, Hobart, Crown Point, Lake Station, New Chicago. It's an extreme honor to collaborate with my colleagues and you all. Close to 15 years in youth and family services and work. Also work specifically in the juvenile justice system. So just excited to be a part of the conversation and to see what we can come up with to assist this population. So thank you.
And I don't know who CC is.
It's the captioner for the
Got
live
it.
stream.
I got it. That's awesome. We don't need to talk to CC then. All right. Well, I don't think I left anybody out. If I did, please speak up. Okay. Senator Kreider, do you have anything to add before we move on to the main event?
No, I think it's good to see the group. A couple of the folks I know previously. I actually attended Eastern Hancock High School, so and then Warren Central is in my Senate district. Worked with many of the folks that are represented on the commission prior, and so I'm looking forward to this. This should be a great discussion.
Well, again, I want to express my thanks for everybody for participating. I'm glad. I knew it took a little bit of time, but I think it's important to know everybody's backgrounds and the powerhouses that we've put together here to take care of the youth in Indiana. With that, Nina and Josh, I'm going to turn it over to you two to take over.
Great. Good morning, everyone. I'm going to share my screen so that you all can see the presentation. And while I do that, I'm going to turn my video off so I don't get distracted on Zoom looking at myself or everybody else. So give me 1 second. Okay, can everybody see that just to make sure it's working? Great. Well, again, thank you to Representative McNamara, to Senator Kreider, to Julie, to Dawn, who was one of the folks that we spoke to early on in this process, for bringing the CSG Justice Center on board. We're really excited to get started. This morning, what we really want to take time to do is provide a little bit of background about the Justice Center for those folks that aren't as familiar. Provide some information on the research that will serve as the foundation for this preliminary assessment and the work that lies ahead, and then provide an overview about the assessment process. What are we going to be undertaking over the next 6 to 9 months together as a task force, and how the Justice Center can support the task force in moving forward. And at the end, we'll have some time for conversation where we really want to hear from you all what your priorities are for improving outcomes for youth in the justice system in Indiana, who are folks that we should be speaking with as we conduct this assessment, and then what are the next steps in terms of meeting schedules, focus groups, assessing data capacity, et cetera. So for those folks that aren't as familiar, the Council of State Governments Justice Center is a national nonprofit, nonpartisan association. We support state government officials in all 3 branches, and we provide practical advice or research strategies to increase public safety and strengthen communities. As Josh mentioned, he and I are from our juvenile justice program. Emily is from our research division. But across the Justice Center, we focus on a range of criminal and juvenile justice issues, including the intersection of mental health and law enforcement. We have a justice reinvestment initiative. We work on substance use issues as well. So a range of issues that the Justice Center focuses on with criminal and juvenile justice officials. One thing that people often ask, and I think this was part of the conversation we had earlier on in Indiana, is how is the Justice Center unique or distinct from other national organizations that support states and counties with criminal and juvenile justice reform? And I think for us, our juvenile justice program in particular is unique in a number of ways. One thing that we always talk about is that we are nonpartisan. We have worked collectively in a diverse group of states and counties across the country with state and local leaders across the political aisle. And we use data and research to drive the work that we do in all of the states and counties that we work in. Secondly, our focus is on improving public safety as well as improving outcomes for young people in the juvenile justice system. So our focus is not just on reducing incarceration, not just on reducing recidivism, but how do we measure and improve positive outcomes as well as reduce recidivism for all youth that are in contact with the juvenile justice system. And we look at the entire system as a continuum from the point of entry, how a young person comes into contact with the system, all the way through re-entry if young people are incarcerated at the deepest end of the system. And you can see here on the screen just a couple of the publications that we've produced over the last several years that really lay the foundation in terms of the research and the core principles for how we conduct our work in states and counties. You can see here on the screen, we've worked with a number of states and counties across the country in the last several years to assess their juvenile justice systems and to help states and counties facilitate a systems change process to improve outcomes for young people that come in contact with the juvenile justice system. And we can, throughout this process, provide examples for how these states and jurisdictions have gone about reforming their juvenile justice systems, what's worked and what hasn't worked, and where they've experienced challenges. I started to allude a little bit to this earlier in describing what makes us unique or distinct. But our process is not only data-driven and research-based, but we're also collaborative. As you can see by all the folks on the screen today, one thing that we had talked to Julie and Representative McNamara and Senator Kreider about was ensuring that there's a breadth of stakeholders, a diverse array of stakeholders that participate in this process to shape the priorities, to shape the direction moving forward. Additionally, we always make an effort to build upon past and current reform efforts. We don't want to recreate the wheel. We know that states and counties have already made significant progress in improving their juvenile justice systems prior to our partnership, prior to us working with the state and jurisdiction. For example, JDAI has been mentioned a lot here in Indiana. So we don't want to recreate the wheel. We really want to build on those reform efforts, build on those strengths that already exist in the system. Our assessments are also objective. We focus on analyzing the entire system, as I mentioned, from point of contact to reentry, and we look at equity issues or racial and ethnic disparities at every decision point along the juvenile justice continuum when we conduct a comprehensive assessment. We also, when we do a comprehensive assessment, get access to case-level juvenile justice data, looking at youth outcomes, looking at system performance, to really see what's happening within a system at each point along the continuum. I know that here we're going to just be looking at the capacity of Indiana to collect and track that data, but if we move forward and conduct a comprehensive assessment, we would try and get access to case level data. We also conduct focus groups and interviews. We want to hear from everyone that's involved in the juvenile justice system, to hear what the challenges are, what's working, what's not working, and what their priorities are for making improvements. And as I mentioned, we're research-based. We want to know what's already worked, what can we adopt or implement in the state that we're working in, building off of what other states and jurisdictions have already done to support you all in whether it's legislatively, administrative policy reforms, looking at funding decisions. We really want to use the research to inform the decisions that are made in a particular state or jurisdiction. And lastly, after adoption of policy changes, we also partner with states and counties to provide implementation support. We know that while it is a huge undertaking to adopt policy change, we also know that where the rubber hits the road is often during implementation. And so we continue to provide that support to jurisdictions. So before I get into some more details around what this preliminary assessment process will look like in Indiana, I want to start by providing a little bit more background and context, much of which is the foundation for how we go about conducting our work in states and jurisdictions. And some of this may be repetitive. I know that Josh and I have both presented to some folks in Indiana in the past, but we thought it was important as level setting for everyone in this task force to be aware of the research and how we conduct the work that we do in states and counties. So first, just by talking about the national context, the national landscape, and then we'll use Texas as our case study for what we're seeing around the country. So nationally, we've seen about a 60% decline in juvenile incarceration rates, and we've seen that in pretty much every state around the country, a significant decrease in youth being incarcerated in the deepest end of the system. And that's a significant accomplishment in and of itself that should be applauded, a testament to the hard work and commitment across the country of serving youth closer to home in their communities. However, as states and jurisdictions have moved to serving and supervising youth in their communities away from these large correctional facilities, with a variety of treatment and services, we have also seen policymakers and system leaders wondering how these kids are doing now that they are being served in the community and not in these large scale facilities. Are we getting better results for kids after we've made these policy changes in terms of recidivism and other positive outcomes? How are we spending our resources, and are our resources being used most efficiently? And are we getting what we wanted to get as a result of these policy changes? So to use Texas as a case study, we conducted a large-scale study in Texas several years ago. One reason being that Texas has an incredible data system. We were able to look at almost 1 million records something that very few states in the country are able to do right now. And Texas also implemented a number of policy reforms in the 2000s, including closing some of their state facilities, mandating that certain offenses could no longer result in incarceration. And they moved a lot of the kids closer to home to being served in the community, either in smaller county facilities or under community supervision, and shifted their resources to reflect those policy changes. And so what we wanted to do with the study is to see if the outcomes matched what was expected based on these policy reforms. And so what we were able to do is conduct an apples to apples comparison of youth that were eligible for incarceration. So looking at similar youth that were supervised in the community, as well as youth that were released from state-run secure facilities, but all of these youth were eligible for incarceration. And what we found was that supervising youth in the community is generally the most effective public safety strategy. Youth released from state-run secure facilities were 21% more likely to be rearrested within 1 year compared to similar youth that were supervised in the community. And we found that when rearrested, youth that were released from state secure facilities were more likely to commit a felony than those that were rearrested on community supervision. As I mentioned, to support their reforms and moving young people back into the community, Texas also shifted their resources away from their large state facilities to the community, to local probation departments for the provision of supervision and services. And you can see here a 68% increase or change in how those resources were being allocated back to the community from 2005 to 2012. So now a little bit of the bad news that we found in our study. We found that while all of this money was being shifted back to the community to support supervision and services, they did not necessarily produce the impact that leaders had expected or wanted. And so what you can see here on the screen, if you look at the various intervention types on the left that youth could participate in, and their recidivism rates, there was very little difference before and after the reform. Recidivism rates were still higher for those in state incarceration, but in terms of all of the different intervention types that youth could receive in the community, their recidivism rates were very similar. And youth who received no interventions at all had the same probability of rearrest as youth that received various types of programming in the community. As part of our analysis, we also created a composite risk of reoffending score for youth, and then we analyzed what should have happened to them based on that risk, as well as the risk need responsivity principles, and what actually happened to them compared to what was expected. And what this slide shows is how few kids who should have been diverted or deferred or placed on probation, what actually happened to them and how many of them their outcomes reflected what was expected. And so you can see out of those youth who were diverted or who were expected to be diverted based on their risk of reoffending score, only 21% were actually diverted. And you can see similarly for deferment as well as for probation, out of those youth where a deferment was expected, only 37% were deferred and 43% in probation for those that were expected to be on probation based on their risk of reoffending score. Similarly for detention, youth were detained at far higher rates than warranted or than expected. For the 91% of youth where detention was not expected, over 43% of those youth were still detained based on their risk score. And we also saw that both low and higher risk youth received higher levels of supervision than warranted based on their expected level of supervision based on the risk of reoffending score. And what this slide is showing in terms of over supervision, you can see by low risk as well as by high risk, the points equal more points on the scale means higher levels of over supervision that you could see on the right-hand bars, the percentages of youth that were over supervised, even those youth that were low risk were being over supervised in the juvenile justice system. And then we also found, and I don't think this is surprising, unfortunately, to most people, that Black youth were the most likely to receive more intensive supervision than warranted or expected compared to their peers based on their risk composite score. The study also looked at if youth were being matched to services based on their targeted needs. We wanted to dig deeper into the question of why the outcomes we were seeing were not as expected after the policy reforms were adopted and implemented. And what we found was that youth were not sufficiently being matched with research-based services that address their actual specific needs. And this slide provides the example of substance use. So you can see on the left-hand side the number of youth that were identified as having a substance use need compared to those youth that actually received a referral to a substance use program. So very little or very few youth that were identified as having a substance use need actually participated in a substance use program. Additionally, we also saw that in most counties in Texas, low-risk youth stayed in programs longer than high-risk youth, and they received higher dosage than higher-risk youth. And what we know from the research is that with low-risk youth, oftentimes if you do nothing at all, they grow out of their adolescent behavior and don't reoffend. We also know that oftentimes programs are serving more low-risk youth because they're easier to engage. High-risk youth are more challenging, have more diverse array of needs, and they're harder to engage in these types of programming. However, you get more bang for your buck if you address those higher risk youth that are more likely to reoffend. A couple other important findings that revealed why outcomes for youth in the community in Texas were not what was expected. One, the registry of programs that were available to youth in the community were all over the board in terms of being evidence-based. The state really lacked clear standards for what evidence-based means. I know we always throw around that term, research-based or evidence-based, and therefore programs might not have thought or might have thought that they were evidence-based or said they were evidence-based, but they were not actually implementing their programs with fidelity to the research, or they didn't have the outcomes that demonstrated their effectiveness, that they were actually evidence-based in reducing recidivism and improving outcomes. And lastly, while data was being collected by programs and agencies, the data was not necessarily being used to track implementation fidelity or to look at youth or program outcomes. And therefore, the data was not being used to hold programs and providers accountable for youth outcomes, or to ensure that resources were actually going to programs that we know worked. And so that's something that's really important to keep in mind. It's not just about collecting and measuring data, but how is that data being used, and how is that data being used to inform the types of programs that are available and funded to serve youth in the juvenile justice system.
Nina, this is Josh. Just a few points of additional context to add on to what Nina said before sharing some of the lessons learned here. We know, it's always dangerous to have another state as a point of comparison, but just a few reasons why we think this case study in Texas really exemplifies the challenges that juvenile justice systems across the country see, and that some of these issues may be apparent in Texas. The first is that Texas actually employs a set of best practices. So the findings that Nina just went through in terms of youth not being matched to the appropriate level of supervision and youth generally being over supervised, youth not being matched to the appropriate level and type of services, that's despite the fact that counties across Texas employ detention screening tools, risk screening tools, validated risk and needs assessments. As you saw, they invest in evidence-based practices and had a registry of evidence-based practices. They have robust data collection systems that allowed us to do this study of almost 1 million records. So they have a lot of the tools and the structures in place. But as Nina went through, what we found is that much of that was not actually being implemented consistently and with fidelity across the major counties in Texas. And so as a result, this significant shift that took place in Texas, that's taken place in Indiana, that's taken place in almost every state across the country in terms of youth who used to be incarcerated now being served in the community, they invested hundreds of millions of dollars to provide improved supervision and services to those young people and saw no improvement in outcomes. So, Nina will sort of go through the key takeaways, but I think it's just important to emphasize Texas, as is not a state that's sort of on the far end of not having reformed its juvenile justice system. It's both at the state and local level passed substantial statutory changes, administrative changes, has structured decision-making tools, best practices in place, and yet we really found in looking at the data that recidivism rates had not improved at all for young people, and that there was really a lack of adherence to research-based policies and practices. And that's really a consistent finding in almost every state where we've worked, that there might be a lot of good isolated practices, good isolated policies. Some of them may be implemented well in certain spots, but consistently jurisdiction-wide resources are not being invested effectively to improve public safety and youth outcomes.
Great. So as Josh was alluding to, there's a number of reasons why we highlight Texas and why we use Texas as a case study, even though obviously every state is unique and has different contexts. But the first, which is good news, is that we know that reducing reliance on incarceration has been successful. States around the country have reduced incarceration for young people, and we have not necessarily seen crime go up or negative outcomes from keeping youth in the community. It's a cost-effective public safety strategy, which is good news. Second, as Josh mentioned, despite the increased use of decision-making tools like risk assessments or detention screening tools, youth, and particularly youth of color, are not often being matched to the most appropriate level and type of supervision and services. And we saw that happen in Texas with services, but we also saw that in Texas with regards to matching young people to supervision based on their expected risk scores, and particularly exacerbated for youth of color, for Black youth. We also know that most jurisdictions, not just Texas, are struggling to ensure that the services that youth receive are actually research-based, that they're implemented with fidelity, and that we're collecting data to ensure that those services are effective in reducing recidivism and improving outcomes for youth. Fourth, what doesn't get measured and acted upon doesn't get done. So as I mentioned, really important to be able to collect case level juvenile justice data to understand what is happening to a young person at each point along the continuum, to understand the effectiveness of the system as well as of services that young people are receiving. But it's also important to be able to analyze that data and to use that data to measure system performance, to hold providers accountable, and to actually use that data to drive your decision making. So that brings up the question of why are we all here today, and how can we at the Justice Center support Indiana and support this task force in conducting a preliminary assessment of the juvenile justice system with the hope of conducting a more comprehensive assessment down the line. And I want to say one thing that Julie said about herself and her role with the commission. Josh and I and Emily at the Justice Center, we really see ourselves as staff as well, staff to this task force. We're here to help you conduct the assessment, to provide examples and best practices from other states and jurisdictions around the country, to help you facilitate a process. But we always want to make sure that we say that this is a state-driven or jurisdiction-driven process, driven task force and assessment. You all are the ones that live this every day, and that can better identify your priorities and determine how the state wants to move forward. And we're really here to help you facilitate that process. So the assessment will be guided by this task force that was established and that's meeting this morning for the first time, chaired by Representative McNamara and Senator Kreider. we wanted to create, as you can see by the list on the screen and the faces that you see as well, to bring together an array of diverse stakeholders across branches of government, across youth-serving systems that are decision makers and that play a significant role in the juvenile justice system in Indiana. And the task force's role is to really oversee and guide this process and determine how Indiana wants to move forward with juvenile justice improvement. So what are the goals and objectives of this preliminary assessment? The goal is to position Indiana to be able to develop a statewide plan that is consensus-based and data-driven to ensure that the juvenile justice system reduces disparities and improves outcomes for youth while also protecting public safety. So I've laid out here the 4 objectives that we have, or 5 objectives that we have in front of us for this assessment process. The first, as I mentioned, is to identify opportunities to leverage and build upon past reforms. We always want to ensure that we're building upon the strengths that the state has already experienced, and we don't want to recreate the wheel. The second is to evaluate the current capacity of Indiana's state as well as local agencies to collect, analyze, report, and use juvenile justice data. Being able to collect data is critical not just for us to conduct a comprehensive assessment, but for you all, for policymakers, for system stakeholders to be able to measure what's working, what's not working, and make data-driven decisions. Additionally, we want to establish the priorities for system improvement that's shared across this breadth of stakeholders and secure buy-in for conducting a collaborative statewide assessment and an improvement process going forward. We also want to look at legislative code, look at statutes. It was mentioned that statutes or juvenile code has not been updated in 20 years potentially. And so we want to look at the juvenile code, look at the funding approach that the state provides for juvenile justice, and see how that's aligned with what the research says and with national best practices. And the 5th is to prepare and present a report to all key stakeholders that identifies the priorities that are shared across this task force, that provides initial recommendations for improvement, whether that's legislative, administrative policy, judicial rules, appropriations changes, and develop a detailed roadmap for developing a more thorough, comprehensive statewide plan. So how do we intend to do that? So this was mentioned earlier. We're going to engage in interviews and focus groups and conversations with a range of stakeholders across the state to learn more about how the system operates, to learn about the barriers and challenges to improving outcomes for young people in the juvenile justice system, and identify opportunities for improvement. Where do you see the system moving and needing to go, and how can we capitalize on that? As well as reviewing documents, policies, and materials. So we will look at analyses, annual reports, strategic plans from reform efforts that have taken place to this point. And we will also look at legislative code, whether that's the juvenile justice code. I know there's other relevant statutes that play a role in the juvenile justice system and how the system operates. We'll look at the juvenile code to identify strengths and gaps in terms of how it's aligned with best practice and research, identify potential areas that are of concern or confusion, and we'll make initial recommendations on how to revise code to reflect research and best practices. We'll also engage in interviews and focus groups with members of this task force, with commission members and policymakers, state and local agency staff, judges, probation staff, attorneys, law enforcement, service providers, other youth service systems, including education. And we always make sure that we talk with young people and families that are most impacted by the system to get their input on what's working, what's not working, and what changes that they would like to see. We'll also, as I mentioned, look at the capacity of Indiana to collect and analyze case-level juvenile justice data. I think this is one of the primary areas of focus that we will look at in Indiana. one thing that struck us when we were engaging in earlier conversations with folks in the state was the challenge that data collection might present to conducting a more comprehensive assessment of the juvenile justice system. So we really want to get a handle on what state and local agencies are collecting, what data systems they're using, how these data systems are talking to one another, what kind of case level juvenile justice data is available for us to conduct a more thorough assessment to measure youth outcomes and to measure system performance, what type of data is being used to measure racial and ethnic disparities. And then we can issue some preliminary recommendations for how to strengthen the capacity of state and local agencies to be able to collect, share, and use this data. And so we'll engage in conversations with research staff, with IT staff, within state and local juvenile justice agencies to see how data is being collected, analyzed, and reported, and identify strengths and gaps to that collection and analysis. In conducting our assessment, our team uses a framework that is based on 4 core principles that has been demonstrated by research to reduce recidivism and improve youth outcomes. So these 4 principles are what we will use to guide the questions that we have for stakeholders, to guide our review of statutes, of policies, and other resources. And I won't go into them in too much depth. One of the documents that was listed on an earlier slide that we can share with the group is a policy brief that we published that outlines these core principles and provides background research or synthesizes the research on why these 4 core principles are shown to reduce recidivism and improve youth outcomes. So the first is to base supervision, services, and resource allocation decisions on the results of validated risk and needs assessments. The second is to adopt and implement programs and services that we know actually work to reduce recidivism and improve outcomes, and to use data to evaluate the effectiveness and evaluate direct system improvement. The third is to employ a coordinated or collaborative approach across service systems to address youth needs and promote positive youth development. We know that young people who are in the juvenile justice system are often touched by other youth service systems, education, behavioral health, child welfare, and it's not the juvenile justice system's role alone to support those young people, but they really need to work in collaboration with other youth serving systems. And the fourth is to tailor system policies, programs, and supervision to reflect the needs, the developmental needs of youth and adolescents. So we know that youth are not many adults. They have very different brain development. We know the research on brain development. We know that they have distinct developmental needs. And so the policies and practices in the juvenile justice system need to reflect those distinct needs. So what do we hope will come out of this preliminary assessment? So at the end of the process, at the end of this preliminary assessment, the goal is to develop a summary report that can position Indiana to develop a more concrete plan for statewide system improvements. And the summary report that will be created will include a number of items. The summary report will include an assessment of Indiana's juvenile justice system in terms of what's working, what's not working, what improvements are needed based on our conversations, based on our review of statute, based on our review of other policies and materials. What data would be available if a comprehensive assessment were to be conducted, and what steps need to be taken to ensure that data could be available and ready to be analyzed. So looking at the strengths and gaps of data collection across state and local agencies. The summary report will also identify consensus-based priority areas that the task force has identified for improvement, as well as initial set of recommendations to better align Indiana's policies, their practices, how funding decisions are being made with what the research shows works and with best practices. And it'll detail a roadmap for how Indiana can develop a more comprehensive, detailed statewide plan for improvement. What activities would need to be conducted? What should the timeline look like? Who needs to be involved, et cetera, to develop and advance concrete recommendations for improvement. And the summary report will be presented back to this task force, as well as to other relevant commissions or committees as desired by the stakeholders on this task force. Lastly, in terms of timeline, so the scope of work for this preliminary assessment is intended to take place over the course of 6 to 9 months. Here we've laid out an 8-month timeline for our activities in terms of reviewing code, identifying opportunities for improvement, establishing priorities, evaluating data capacity, and then preparing and presenting the final summary report to all key stakeholders. And we can, talk about the timeline, obviously, depending on how things move along and the conversations that we're able to have. Very different, I'll say, in a virtual context than when we typically partner with states and we're able to travel across the state to have these conversations. But right now we're intending for this process to take place over the course of 8 months or so. So I'll stop right there before we get into our discussion and conversations. See if there's any questions. Josh, I'll turn it to you just to see if you have anything else to add about the assessment process.
Yeah, and I can help go through. There's a couple of questions in the chat, but just to distinguish folks, sort of why we're calling this a preliminary assessment versus a full assessment is at this point, the goal, as Nina has laid out, is really just to get an overarching sense about how the system is working, what folks across state and local levels, service systems perspectives see as priorities for system improvement, and where are the real data gaps and challenges with the goal of trying to potentially establish some shared performance measures. If we can work towards those goals and establish some consensus priorities amongst this group, then the hope for next phase of this work in terms of more in-depth assessment would then to be actually to collect and analyze case level data at the local and state level. That's a more robust process that includes analyzing arrest data, referral data, diversions, dispositions, to probation at the local level, to state incarceration, looking at recidivism, technical violations, other outcomes. As Nina mentioned, and I think there was a question about this in the chat, is always disaggregating all of that data by race, ethnicity, gender, other key population level and community level demographics to really hone in on some of the priorities that are established by this group and have a data-driven understanding of how the system is functioning and where there are opportunities to continue to ensure that juvenile justice policies and practices are tailored to local context, but to look at opportunities to establish more statewide research-based standards and ensure policy and practice across the state. I think as Rep. McNamara mentioned, there really isn't sort of justice by geography, but there really is a common research-based approach. So that's the hope. We've got this kind of first phase to better understand the system, and then hope for a next more data-driven second phase. In terms of some of the questions that were asked, so I think I mentioned certainly an important part of this process is looking at not just public safety, not just youth outcomes, but looking at equity from both a data perspective as well as from a policy and practice perspective. And that's work that we do, as Nina mentioned, with every juvenile justice system that we work with across the country, and doing that both in looking at policies and practices, looking at data, and also talking to youth, families, and communities. I think there was another question about just the resource allocation circumstances in Texas. And just to be clear about that data, I think I mentioned this before, but again, as a result of the reforms where youth basically shifted from state custody to county-run probation departments, as a result of that shift in population, the Texas legislature appropriated hundreds of millions of dollars for enhanced community probation and services. Most of that was used for community-based supervision services. Some of that was used in residential, but sort of the key point from this study is despite those hundreds of millions of dollars of resources that were invested, at the local level, counties did not experience any improvements in public safety or recidivism rates. And so certainly, given that caution and given that challenge that we see in other states, one of the things that we intend to explore as part of this process is to look at how dollars are allocated at the local level, but also the significant state funding that goes into providing services at the local level. And again, at least at this point, get initial sense of whether that resource allocation is being used in alignment with research and best practice. I think
And I would say, Josh, just I don't think I mentioned this in the beginning. I mentioned the core principles document, but we can also send out the findings and results from the Texas study and the follow-up study in Texas are available on our website, and we can disseminate those reports as well to this group. Obviously, the reports provide a lot more detail around the findings and the methodology of the study.
Yeah. There's another question about behavioral health. Yes, a substantial population in Texas, like in many states, had substance abuse and mental health issues. Most jurisdictions that we work with are seeing an increasing proportion of youth with behavioral health issues, both in the community as well as who are incarcerated. But again, Texas has robust screening and assessment tools to assess for behavioral health, had an array of behavioral health services. And again, despite that infrastructure, didn't really see any improvements in youth outcomes. And so that's certainly, again, an issue that we hope to look at in Indiana, and why we've got this collaborative task force is to try to identify what are the common risks and needs that are driving youth into the juvenile justice system, what is the array of services that are available, what kind of partnerships exist, not just with the state and local level, but juvenile justice, education, behavioral health, to be able to provide services that are effective to meet those needs. And then I think lastly, Nancy, you had a question about service matching.
I do have a question, and I don't know if it's something that you all want to get into today, but if you have any resources around this. You mentioned that in Texas, well, I think it was in the slide around lessons learned for Indiana too, that youth of color are not always matched to the appropriate services. And you also reference the need for evidence-based services. I think one of the things that where we struggle in Indiana is that a lot of the evidence-based services, depending on your definition of that, are not normed on populations of color. And so for youth of color to be referred to those services may not be what is most needed for them. And so I didn't know if you found that in Texas or had any resources or information that you could bring to the conversation in Indiana around that.
Yeah, so the data, particularly for youth of color in Texas, was about how youth of color consistently received more intensive system supervision than was warranted, so that they were not appropriately matched. Everyone was not appropriately matched, or many young people were not appropriately matched to the level of supervision, but youth of color, and particularly Black males, were the most likely to get more intensive supervision than warranted. The service matching data, we were not able to disaggregate at the level of race and ethnicity, but there is national research consistent with what you said, which is that matching youth of color to services is often more difficult. And we've seen in our work in Connecticut and Colorado and other states that youth of color are less likely to get more treatment-oriented services and are more likely to get more compliance kind of oriented services. So it's certainly an issue and something that we hope to take a look at. Just in terms of the question of evidence-based services, you know, there's a lot of discussion about this in the field. And what we ultimately say to jurisdictions is the best way to know if a service is evidence-based is, do you have data on its effectiveness? And is that data really looking appropriately at recidivism, including in the youth and adult system, looking at recidivism by risk level, and making sure that it's, it's an appropriate time frame. And so that's one of the key questions that I know Rep. McNamara and Senator Kreider were interested in bringing us in to Indiana in the first place is, does Indiana have data to know whether its services are effective and youth of color and youth across the state are actually receiving those services? So that's definitely going to be a starting place, because the best position for any jurisdiction to be in is not have to worry about, well, does this registry or does this website say that a program is evidence-based, but does our data tell us that our programs are working? And so that's where we'll start our focus.
Thank you. That's very helpful.
Just to add to that quickly, in terms of the point on youth of color, as Josh mentioned, and in the assessments that we have conducted in states and in counties, we have seen youth of color not just less likely to receive treatment, but less likely to be referred to treatment. So oftentimes, if a jurisdiction is offering services, youth of color will often not even be referred to those services. They'll just have more supervision. And we can share some of that information, as well as the programs, as you mentioned, Nancy, not necessarily being normed or not targeting specifically youth of color, their particular context, their particular needs, looking at, being culturally responsive. Those are some things that we try and get at with our focus groups and our interviews as well, is to try and figure out how are states and jurisdictions actually supporting those populations, so we can provide some information about that as well.
I think there are one or two additional questions more about solutions, which we can certainly get into and continue discussions. But there's also a comment which we definitely want to make sure we have time to get feedback from you. So Nina, maybe if you go to the discussion questions.
Yeah, I do see a question, and it's hard to look at my chat and share my screen at the same time, but about having dialogue about this group and the role of this group. And so we definitely want to hear from you all, any questions or comments you have about how this task force can and should work moving forward. We have two questions that we wanted to pose to the group. So I'll just share those two questions at the same time, and then we can get into discussion. One, what do you all see as the most significant barriers and challenges to improving outcomes for young people that are in contact with the juvenile justice system in Indiana? And then what are potential areas of focus that you want us to look at during this initial assessment process? And then we can get into who do we need to speak with to make sure that we're listening to all of the voices in Indiana. But that's something we can even do more offline, since we don't have a ton of time this morning. But in terms of where do you see barriers and challenges, where would you like the assessment to focus, as well as what do you see as the role of this task force? So I'm not sure, Julie, Representative McNamara, Senator Kreider, the best way to, in a 40+ person Zoom environment, I don't know if there's a hand raising function, but wanted to open it up for conversation.
Yeah, maybe folks can either raise your hand if you know how to do that, or if you want to indicate in the chat that you have a comment.
They can also just unmute themselves. I think that would be fine. I just want to kind of summarize what and set kind of what we're doing, because I have so much background knowledge on why you are here today that you probably are missing, but reiterate that this will probably be 3 phases. This is phase 1, where they're going to be doing interviews and just gathering data. Phase 2 is the data analysis, disaggregation. Phase 3 is solutions, if you want to look at it from that perspective. The first phase right now is just really getting a grasp of where we are in Indiana. And then once the interviews and those sort of things take place, we'll be able to move on to phase 2, which kind of is diving deeper, if you want to say it, into our practices in Indiana. So some of those things that you've asked probably aren't able to be answered today, but after phase 2 probably will be very easily answered in Indiana. So I know I wanted to call you Chief Lide, but is that a promotion, demotion? I don't know. Well, you asked
Chase
first.
is good enough. Chase is good enough. Thank you. Two areas of focus I would hope that this group would address regarding policing in schools. The first one is having state recommendations for counties to ultimately implement about alternatives to arrest at the point of arrest. If we are aggregating data about arrest in schools and comparing arrest across socioeconomic classes or ethnic groups, it is imperative that officers at the point of arrest would have other options rather than refer the kid to criminal court or do nothing. And currently, in most places, that is the option. I'm so thankful that Mr. James Taylor is involved with this group, because what he's doing in Warren Township is something that we should all be looking at across the state about how we address criminality or low-level offenses at the point of arrest. Because although in Marion County or other places, alternatives to arrest may exist, they're not communicated well. There's not a prescribed plan of action. We don't have continuity in what that option looks like, and we certainly don't have training for how officers can utilize those systems. And so the work of this group would be incredibly important if we could come up with a recommendation for alternatives to arrest at the point of arrest, not referring to the prosecutor, not referring to probation first, but collecting those resources at the beginning before a police report is made, before the paperwork is referred to criminal court. School resource officers don't want to make those arrests. But if there is no other option besides arrest, all you can do is nothing. And that doesn't help the kid either. So for some kids to get these resources and to get these programs that we're talking about, it has to be predicated by an arrest. And that is not our goal. The second thing is for police officers working in schools right now, there's a state statute that defines what a school resource officer is. There is zero enforcement mechanism for a school district to hire one of those specially trained school resource officers. And each school district can hire any police officer without any requirement for training. Last year in the Senate Education Committee, the bill that would require that training didn't even make it out of the committee. But the goal is for every police officer working inside of school during a school day to complete a very basic 40-hour training that would include topics like mental health considerations, school law, adolescent brain development, cultural diversity, cultural competency, the role of an SRO as a mentor and educator, not just law enforcement officer. Those two components to this group would be absolutely monumental from the world that I sit in as a school resource officer. So I'm hoping we can address those challenges together.
Representative McNamara. Henry County is one of 3 counties in the state of Indiana as a part of JDAI that has established school justice partnerships. And many of those diversion resources and options are made available to our schools through some of the JDI funding. And we have seen major progress in that area in relationships with the schools and empowering schools to be able to look at it as school discipline as opposed to delinquent acts. So I think there are some counties trying to work that direction and help our schools have other options other than sending kids directly into the juvenile justice system.
This is Eddie Melton. I got a couple of things real quick. And again, thank you for the presentation. One of the things I hope that we can review, I know forgive me if I'm being redundant, if any of this was ever mentioned in the presentation, if I missed it. There was a report done by Indiana University several years ago about suspension and expulsions within school corporations. I think that data is extremely important to go back. There was something that was glaring that I reviewed when I was on the State Board of Education was how data is reported in regards to the incidents on how students are disciplined. And I think that was something important that we need to go back and look at. One question I do have is, will we be able to offer recommendations of the folks that you all will be interviewing, especially in different parts of the state? I know that there are several groups that I would like to suggest, and that being school superintendents and even family members that probably have experience in the system. Then also another question will be, will we review internal policies in these in the facilities? And the reason why I asked that is I did some research some time ago and asking internal policies such as solitary confinement and things like that in these facilities. I think it's important that if we're going to have a conversation, we look at broad issues that are also internally within facilities. And this may or may not be a good fit across the entire state, but this may work in some other areas to have that conversation. And lastly, I think, I'm sorry, I think Susan just mentioned this, and the academic part. I know I've been a part of a lot of meetings in my district where the question of funding and education and the shared services while students or children are in the facilities and how they continue their education is extremely important in how that works. And I think a lot of folks have been looking for guidance from the state on how to make that work as well. So I'll stop there. I got a lot of other suggestions and thoughts and even questions, but I appreciate the dialogue.
To answer your question, that's why we've assembled all of you here, is to help us find those people in your communities that are going to be valuable to put together and be asked the questions that need to be asked. So yes, definitely we want to include folks from your communities and even beyond your communities. If you know of an expert that needs to be contacted, or a group that needs to be a part of the conversation, that's definitely why you guys are here today, is to be those conduits to get us out into the communities to have those conversations.
In terms of process, Representative, I think what we're hoping to do is put together a list of, focus groups, interviews, people that we would like to speak with across Indiana, and have Julie maybe serve as that liaison to help us connect with folks and get those conversations rolling. And so maybe, I don't know if this makes sense, we can, after this meeting, obviously send out to the group the presentation and next steps. And in that, ask folks to identify additional stakeholders, groups, folks that you think are important to be part of the conversation. And then maybe Julie, you and I can work on identifying who those people are and getting those conversations scheduled.
Sounds good.
I think also, just to address a question of scope, I mean, as you can see just in folks' initial comments, there's so much that's connected to the juvenile justice system, and in pretty much every state where we work, folks want to know, well, are you also going to assess the education system and the behavioral health system and the child welfare system? And while all of that is connected, there's also a need to sort of draw parameters around our work. So just to be clear, in this first phase, we're really looking at kind of the juvenile justice system writ large. And obviously that's hard in a state like Indiana, where much of the juvenile justice work is happening at the local level. But that's why we're focusing on statute, on data collection statewide, on general system functioning, which will include conversations at the state and local level, the relationship between juvenile justice systems and other service systems. At least at this point, as Rep. McNamara laid out, we hope in a phase 2 to be able then to take a more detailed look, not just at the data, but individual agency policies and practices. So doing things like looking at state facility policies and practices and county level probation policies and practices to go along with that in-depth data review. But in terms of this phase, just to set people's expectations, it's really looking across the system at policies, practices, resource allocation, and trying to get a sense from stakeholders across the system where there are shared priorities and opportunities for system improvement.
Hi, this is State Representative Robin Shackelford. I just wanted to echo what Senator Melton said, but I want to add on, definitely see if we can add in the behavioral health or the health component of these youth that are incarcerated or going through community services. I just think that is one of the big founding issues or concerns when it comes to the youth. So if we can get some data on who are affected mentally, whether it's ADHD, ADD, what are some of their behaviors that they've been diagnosed with, that would also be great. And I had actually just sent a group that I wanted to get interviewed to Wendy and Mike, but once we get that information, I will resend that email to Julie or whoever is going to be the liaison, because I think there is a great group of youth, especially here in our area that I work with, that will be able to be interviewed and answer some of these questions that have been affected and touched by the system, but that are in groups and trying to work on everything that they have to do to overcome, whether they were incarcerated or trying to get jobs or things of that nature. So if we can get those couple of things added, that would be great.
I see on the chat function, a few other folks have put in some of their, have identified additional challenges or areas for us to take a look at. Joel, use of different case management technologies, confidentiality, and the way that counties are collecting and reporting data. James, around barriers to cultural sensitivity in terms of programming for certain race and ethnicity groups. So we'll make sure we write all of these down as well. And obviously this is just the start of the conversation, and in our interviews, our focus groups, we're going to dive deeper, and we'd love to get not just the feedback of other folks, but the feedback of people that are on this call, I think in a one-on-one or small group conversation as well, to dig deeper into your priorities. I know there's only a few minutes left, and one thing I realized we didn't talk about is how often this task force will meet and what will be the responsibility of the task force in between. For us, I think we envision the task force meeting in this preliminary phase 1 2 additional times, perhaps once to get an update to see how the preliminary assessment is going, to review any initial findings, and then the second or the last meeting to be looking at the summary report and to determine next steps. And so I don't know how the easiest way to go about scheduling that next meeting. We can probably send around a doodle poll, Julie, but we'll probably envision that to take place sometime at the end of the year, and then for that third meeting to take place sometime early spring.
And you would like for CSG to send, if you have contact information or somebody that you want to have interviewed, all of that needs to be sent to Julie, so she can kind of be the warehouse for that information. And Josh, is there any other like housekeeping type things that we need to ask the task force to do to help facilitate?
I don't think so. I mean, as I think Nina mentioned, we want to conduct an array of focus groups, not just with folks here, but with others that you think have a important perspective on the juvenile justice system. So if you can share those with Julie, we'll be putting that list together, and we can send that out to everyone to take a look at. We can send the PowerPoint out to take a look at. It would be helpful for those on the task force. You know, whenever there are meetings like this, people start asking all sorts of questions about what is this group doing, and you know, why are they trying to, you know, audit our work? And you know, hopefully the messaging has been pretty consistent that this is not an audit, this is not an outside group coming in and trying to tell you what to do. This is an objective, research-based, data-driven, focused organization that's trying to help you take an objective look at your system and identify some initial opportunities to align policy and practice with the research. So, you know, hopefully you come away with that message. If you have questions for us or concerns about our approach, about our agenda, you know, we'd encourage you to reach out to us directly, but also encourage you to share that message with others. So I know it's always hard, you know, we've got a couple of county representatives, but I don't remember how many, lots of counties in Indiana to get that message out. And so whether that's through JDI or Christina or others in terms of that leadership, same at the agency level and at the state level, we find that the more people come to this process, and it was great hearing everyone this morning, with an honest focus on really just figuring out what's best for youth and families, and that this is not sort of a political or agenda-driven process, which I think is important to say in these you know, divisive times, that it's really based on research and data on how best to improve outcomes for youth and families. The more folks are honest with us, and you know, we always say we will keep all of the focus group conversations confidential. So we're not quoting anyone, we're not sharing what the conversations that occur. We just want to hear honestly from people what's working and what's not, and then we'll share that feedback with this group. And ultimately, as Nina said, it's up to this group how to determine what that next phase hopefully looks like. And that third phase, in every jurisdiction that we've worked in, that's based on consensus supported recommendations for legislative, administrative, and fiscal change. Those aren't our recommendations. Those are Indiana's recommendations for how you want to improve the system. And so just really excited about what everyone had to say this morning, and hopeful that will continue with that focus as we move forward in this process. But certainly just want to encourage folks to reach out to Nina or me with questions, with concerns, with any rumblings you're hearing in the community. We're happy to talk to folks as needed.
Also, do you want it to go to Julie or to you two? If they, as we're going through and they want to have some things for you to consider, I know we have more that have been placed in the chats.
Yeah.
What would help you better if we sent them to Julie or you personally?
I'm happy for it to come to me. I don't want to put Julie in the middle of everything to receive all of the messages. I don't want to speak for her, but it could come directly to me, and that would work as well. Julie and I can talk about if the communications will come out from her or from me, but we're happy to get it directly.
I think maybe in the short term, if communications about focus groups and who we should talk to, if that can go to Julie.
Yeah.
But questions, concerns about process, about issues, feel free to get in touch directly with Nina.
And I just want to say that, to your point, Josh, Julie has sent out communication to the county representatives, whether it's all probation or attorneys or law enforcement. So I don't know if we can share that information if folks want to see the language that we've been using, or Julie and folks have been using to share information about this task force. But those communications have gone out to those various constituencies.
Representative McNamara, if I may.
Yes.
I was going to share that I also serve on the commission for the Supreme Court's Commission on the Supreme Court's Commission on Race and Gender Fairness in the Courts. And about a couple of years ago, we did a listening tour throughout the state of Indiana, and that was pre-COVID. We had a really good response when we went to community centers, libraries, to be able to invite people and have listening sessions. We got some really good feedback. And this year, recently, with my role as a school board member, we've been having a lot of feedback with regard to the reopening of schools. And so we had really good turnout with these Zoom meetings. We had about 80 to 100 parents, teachers, stakeholders that would participate. So I guess in this age of the pandemic, I would encourage us to think about perhaps that we might be able to send out the message to be able to be accessible through the internet. And then also, in light of the fact that not everybody has access to Wi-Fi, to think about maybe doing stuff by radio, where we might be able to engage the public, or even outside, socially distanced, so that we can hear from community stakeholders.
We can do that. We do have a limited budget. But the other thing we could do, I think, is use social media, because that seems to be the cheapest form of getting to people, using Instagram, YouTube, or any of those to, kind of rally the conversation in communities and invest a little and probably get more reward from that aspect, because this is important conversations. I think everybody needs to have the opportunity to put in there. But when I went about the task of trying to put together the task force, and with Julie's help, we chose you because you're the best of the best in the state for putting our minds together to try to really bring about better outcomes for our kids. We do know we have a lot of good, but we want good and better and best everywhere in Indiana, no matter where you live. And that's my hope and desire, is when we're completed with phase 3 a year and a half from now, we'll have the best And if anybody knows me, I'm a kind of a competitive person, and I want to be the best. So that'll hopefully be our outcomes in the end. So I don't know that I have anything else to add. Senator Kreider, do you have anything left to add?
No, I was just going to remind folks that last year in Senate Bill 273, we recreated the Indiana Behavioral Health Commission, which will start meeting later in October. There are, again, about 26 members on that commission that will be looking at a variety of kind of the same issues, and some crossover will occur, I'm sure. I will be a member of that commission and certainly be looking for opportunities to leverage some of the discussions that we have with this group in that group. But the timing of the two groups meeting, I think, is really interesting, and it's a great opportunity. So I appreciate the discussion. I've already learned some things this morning, and looking forward to the next several meetings.
Any closing final thoughts, last chance for today?
So Nina and I will put together a follow-up email to everyone with the items that were discussed. And then if you want to reply to that with your suggestions, that'd work.
Okay. Well, again, I just want to express my sincere thanks for participating and being a part of this very important work. As I said, it's been, I've been, I won't say it's patiently waiting for 2 years, but this day I've been really trying to pursue for the last 2 years to make sure that we can have better outcomes for kids in Indiana. So from the bottom of my heart, thank you very much for participating and being a part of this important work, and just look forward to the next, I'm going to say year and a half, because that's pretty much what it's going to take to come up with something that works for us and something that's a consensus across the state. But thank you. And Senator Kreider, did you have anything left?
Oh, thank you very much.
Okay. All right. I just think that's it. Is that it? Am I good? All right. Thank you guys.
Thank you.
All
right. Thank you.
Have a great day.